Piggybacking of an IOL is the term described for implanting a second IOL in an eye which is already pseudophakic. The primary IOL must be in the bag, and then the secondary IOL will be placed in the sulcus. It must be of the multi-piece type, and it's preferable for the second IOL to be of a different material than the primary IOL to lessen the chances of interlenticular opacities. Piggybacking is usually used when you have a post-Phaco refractive surprise, which is usually seen in cases of high hypermetropia or patients who have had previous corneal refractive surgery, or in patients who have done phacoemulsification with a retinal procedure like a vitrectomy, where the IOL power was calculated wrong because of the retinal detachment. So what you do is you do your normal phaco incisions, enlarge your wound, inject some OVD to open up the sulcus, implant your IOL with the leading haptic looking towards the left so that you have the posterior angulation of these multi-pieces, helping you to avoid chafing of the iris post-operatively with excessive intraocular inflammation, with increased pressure and pigment dispersion. The problem with these lenses is that, or with this procedure, is that it's considered a refractive procedure, so you need to know how to calculate your IOL. Well, very simply, the refraction of the patient, the manifest refraction of the patient, multiply that by 1.5 if he's a hyperope, and do the same thing but multiply it by 1.25 if he's a myope. And that's the power of the lens that you should piggyback and inject into the eye. These calculations are not always extremely precise, but it works in most of cases. So this is a simple procedure that can help you salvage a patient or a case where the refraction or there's a severe refractive surprise after his previous surgery.